24 and only in 1 year I got severe baldness. I've consulted many hair doctors and advised me for hair transplant. Dear sir, I'm having severe baldness for the past 1 year, so I consulted a doctor. All he said was that I need a hair transplant. My marriage is in 1 year. Should I go for a hair transplant?
Thank you for your question. You submitted a fantastic photo that shows the top of your head and the diffuse amount of thinning. And you state you're 24 years old, you're getting married in about a year, and you're asking about hair transplant, and that this progression has happened very quickly. And so whether or not it's advisable for you to have a hair transplant. Well, I'll tell you that in the years past, it was rare in our practice to ever do a hair transplant on someone in their 20s because they were losing hair so fast that they would never get close to the volume and coverage that they would be satisfied with one transplant, two, or even three transplants. In the later decades, let's say your 40s and 50s, so many men have hair loss that transplant can be done more strategically, and you can have a limited amount of hair and you can look good, and that's what our rationale was in the past. Well, I'm going to tell you something about something we've done very differently that I think would be appropriate for you, and I'm describing this as if you had come to our practice. When you have this diffuse thinning pattern, what you have is called miniaturization, that the genetics of hair loss is not that the hair falls out necessarily. It's with every growth cycle, the hair comes back, but it comes back thinner. On you, you have lost a lot of hair, but if you were to look under a microscope, you'd be surprised at how much existing hair you have. Now, you have options. You can take a drug like Finasteride. Finasteride is a drug that you take orally that is a blocker of dihydrotestosterone, the byproduct of an enzyme called 5-alpha reductase. Essentially, certain hair follicles are susceptible to the effect of DHT. Therefore, if you reduce systemically DHT, you'll slow down the progression of hair loss. At this current time, people are very hesitant, and that's why people find us, that because this drug has been associated in a small group of men to have long-term sexual side effects. So what we've developed in our practice, and it's been very successful for us, is something called hair regeneration. Hair regeneration is our method of using a material called extracellular matrix combined with your own blood byproduct called platelet-rich plasma. And we've developed a delivery system and a method of formulation, a system, that we're able to take almost any male pattern hair loss patient and make a significant improvement in restoring their hair volume without surgery. It's a one-time injection treatment. We have 3 to 5 years of data supporting the longevity and the lack of regression, such that patients are coming to us from all over the world because of this unique system that we've developed. I think that in our practice, if you were to come, we would say this is exactly what we would do for you. I would advise against doing a hair transplant. You're losing hair so fast that the hair transplant will look like you have a hair transplant. And I would rather you try a medical modality if you want to do the oral drugs and or hair regeneration, because I think that you'll get so much more benefit. In our practice, we've observed practically 100% improvement in the patients who come to us. It depends a lot on when you come. So we always say that the earlier someone comes, we're able to help them and get them a lot more benefit. We've also helped a lot of people who have already recently had a hair transplant, and when they're going searching online about seeing if there's a way to improve their results, they learn about hair regeneration. And so we've actually treated people who recently had a hair transplant, and we've gotten them to have a better yield from their transplant and a better overall result because we've been able to thicken up their thinning hairs. So this way they're not continuously losing hair, but rather they've thickened up their existing hair and their transplant combined actually looks very good. So it's been a great service for people who have moved ahead forward with the transplant because they didn't know about hair regeneration. So I'm speaking very enthusiastically. It's clear that we're very excited about what we've been able to do to help people, and we've essentially eliminated doing transplant as a first-line therapy, but rather do it if indicated in a select group. Most people are very satisfied with the injection alone, and they never go ahead with the transplant. So with that being said, learn more about what I've described, and I would avoid doing a transplant. I don't think it would be the right thing for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.